I'm Mikael.
I'm Tenchi, and today we're going to do CPR,
Or cardiopulmonary resuscitation. CPR training is important because it will save people's lives by keeping blood flow between the heart and brain in an emergency situation.
and whenever we know how to do CPR, we can do CPR whenever it is needed. Now let's begin.
This video is made possible by the help of Uncle James
And Nick John. So now let's show you how to do CPR for both infants and adults. Okay, so there are two types of CPR, the conventional one and the layman one. As for me, I'm going to do the layman version because I'm not a professional rescuer and it is also fit for bystanders. First, you're gonna have to do something called scenery size up. You're gonna, or look around for 540 degrees. You're gonna have to check above you, behind you, left or right. If it is all clear, then proceed. This is what you should do if you want to check a person, if you want to know if a person is still conscious. Number one, you have to tap the person's or victim's shoulder. However, you should not slap the victim's face, and you should not shake the victim or also cause more injuries. Watch this procedure. Excuse me there, are you awake?
Another way to check the person breathing, it's actually using your knuckles and rubbing the sternum, which is here, which connects the rib cage through via cartilage to protect the heart and lungs from injury. You rub it like this. There are three parts of the sternum: the manubrium or upper sternum, the body sternum or the middle sternum, and the xiphoid process, the lower sternum. Here, the lower sternum is where we'll put the knuckles of our hands and rub it to check for breathing. And if the person does not respond, you do the following.
The ABC step. Step 1. Must make sure the victim's head must be placed in this position. Head tilt and then chin up. Then what you're going to have to do is to place your ear near a person's airway while you're looking at the person's chest. Make sure that there are signs of breathing, and the signs of breathing should be the following two. There should be a rise and fall of the person's chest, which is the reason why you should be observing the person's chest, and then you should feel air coming out from a person's nose or mouth. With that, you'll know that the person is unconscious, and you can only do it not more than 10 seconds. If there are no signs, tell everyone around you that the victim isn't breathing. Then the next step is checking the victim's pulse.
So there are other ways to check if the person has a pulse or not. So you use two fingers and check on the carotene pulse right here on both sides. If you don't feel any pulsing, you need to call an ambulance immediately. But you're not allowed to declare the person dead because only a physician can. While waiting for the ambulance, ask around to people if you can perform CPR. If it happens that the victim's friend or family refuses, then do not attempt to perform CPR. However, if they allow you, then proceed to do CPR.
You might be wondering, what does CPR mean? Well, in other words, CPR means cardiopulmonary resuscitation. Cardio refers to the heart, pulmonary refers to the lungs, and resuscitation refers to the word revive or back to life. The use of CPR is to make sure a person gets to be unconscious again or increase the chance of surviving. Now what you're going to do next is that you place your heel of the palm between the nipple line, and then you interlace your palm with another, and then you lock both of your arms, and then push your weight a bit forward, and then start pumping up and down, and complete the recoil.
here, and now it should be ready. If there are 2 green lights, that means you're good at the pressure and the rhythm. But with this red light, then that means I'm gonna be bad at this. So just wait, and then let's start.
As you can see, blood is circulating to the brain, which means I'm pushing at the right rhythm and depth.
Okay, so after we revive the patient, we're going to put it in recovery position. Depending on where you're facing, you have to do like this. This arm should be right here. Put this one over here.
Yeah.
Right here. And then we will roll it over one.
Hips and shoulder.
This is going to reset the legs to make it more stable. And then see this here needs to be at an angle of 45 degrees, the arm.
You need to position the patient's arm at a 45-degree angle to make them breathe comfortably.
Infant CPR is different from adult CPR because in adult CPR you use 2 hands. Well, in infants and newborns, you use 2 fingers. Like doing CPR on an infant, you must do with 1/3 of its body or 0.5 inches. Infant's chest depth of force you apply when doing chest CPR. Like this. When doing rescue breath with an infant, unlike the adult where you pinch the nose and blow them through the mouth, you actually have to cover both the mouth and the nose. That. So unlike the adult recovery position where you roll it to the side towards you, instead, for the infants, you do something like this. And then rub until it burps. And make sure to do it gently. Thank you for watching.
Hope you learned something in this video. Bye. Bye.
You want to know what's inside a rescuer's bag? Check it out.
We have basic equipment or medical use, like this regular bandage, nose pad, sanitary napkins for bleeding. Okay, then we have roll bandage, cotton, and alcohol. This one, IV fluids for cleaning wounds. Band-aid. This ointment for wounds and burns.
Why not you check the advices from our professional rescuers?
You need to check the whole area. For you, it is safe to help that victim. There is rule. Do not make yourself to be another victim. Check if there are any falling debris or branches of trees. When you check, it's clear, approach the victim. If there are any other persons that surround the victim, you ask, what happened to this child? You ask. Maybe they are the one who saw first the victim what happened. First is to check his consciousness. Don't do slap. Ma'am, sir, are you okay?
Give us a like, share, and subscribe.
If you have any suggestions or questions, please comment down below. Please smack the like button and also hit the notification bell, and don't forget to press the subscribe button. Paka paka.